Good afternoon. It's great to be here with friends and colleagues, and we do have what I hope is a really enjoyable conversation for you today. And I think it'll be more enjoyable if folks would drift down and sit at a table. You may be set aside because we have some labels where we hoped people would sit by profession. Ignore them, and just come on down as I'm introducing you. So, as Chris said, this is a collaborative event among several groups at the university who have been working on these issues for quite a while. And here's what we intend. David. I'm talking to David Dadiago, who is probably not here. There he is. Makes my clicker work. It was working a second ago. Thank you. There we go. So here, back one. So here's who we are and what we stand for the Pain Education and Advocacy Collaborative, of which I am a member in my spare time as Director of Curriculum at the College of Osteopathic Medicine. Actually, it's not spare time, it's central to my work. And those are our guiding tenets, as you can see. And here's what we hope you will learn today as you walk out from this session. We really hope that you can describe the 8 dimensions of health and understand that to be well means we need to have a healthy balance of all those 8 types. And that being well doesn't simply mean not being ill. It means being fully well, healthy body, mind, spirit. We hope you will be able to define chronic pain and substance use disorder. What do those terms mean? We intend that you will further develop the emotional intelligence that you already possess that will enable you to better interact and to empower people with pain, substance use disorders, and/or in recovery from those issues. And we'd like you to really understand the roles that different healthcare professions and how they undertake with people with chronic pain, substance use disorders, and in recovery, and how you as a healthcare professional will be contributing to the care of people and to be help them to be healthier and live a fuller, happier, and more productive life by their own demands. So we have a little bit of an introduction, and then we're going to step aside and let you talk, which we found is really the best thing for you, because you can hear me or any of us go on forever, and it's just that. So let me just set the stage here for a minute. Here's the definition of chronic pain and what that means. Can you see that in the back, or do I need to read it to you? I have people going, and I have people going. So I will read it. Chronic pain is defined as pain lasting longer than 3 to 6 months, or pain lasting longer than the expected amount to heal or resolve. And there's the handy Wong-Baker Faces Pain Rating Scale. How many of you have seen and or used that pain rating scale? Oh, good. We're on our way to some understanding about what that means. Here is the definition for substance use disorder. They occur when recurrent use of alcohol and or drugs cause clinically and functionally significant impairment, such as health issues, disability, or the inability and failure to meet their responsibilities of daily living, the things that motivate most of us. So any questions about those 2 definitions? Okay. And here's the definition of recovery. This comes from SAMHSA, which you will see that name a lot, is a division of the DHHS. A process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. That's the living definition of recovery. So, let's see. How this is going to work is we're going to have 3 phases. It'll look like 3 phases. We're going to start with phase 1. And this is, after I give the directions, I'd really encourage any of you sitting in a chair at the side to move to where there's a seat at a table, because I think that's where you're going to have the richest experience. You can certainly talk to each other if you need to stay where you are. If you're leaving at 1, that's fine. Just, excuse yourself quietly. You can still sit at a table. If you prefer to sit over there, we will have other members circulating around who will be available to speak with you. Will those people raise their hands, please, so they know the folks who'll be circulating around during this part? Okay, thank you. So you'll see them wandering. So what we're going to do in this part is we're going to ask you at your tables to engage in about a 20-minute discussion, kind of focusing on these 2 questions, but really the conversation will go wherever it needs to go. So when you start at your table, you will have at each table we have a person with lived experience in one of the issues that we just described, be it chronic pain, be it substance use disorder, be it recovery, or some combination of those. So what we're going to ask you to do at your tables before you start answering these questions, which I'll read to those of you who may not be able to see them, and your facilitator at the tables also has a copy of this. I will ask the facilitator to introduce him or herself, first name, very brief, just who you are, maybe why you're here. Go around the table, get first names, maybe profession. And then facilitators, please read the rules and terminology that are on your facilitator sheet. These rules and terminology will enable us all to have common understanding of the positive language that we are promoting and that we use to ensure that folks with pain, substance use disorder, or in recovery can live to their full potential without the stigma that's attached to many of the words that are used in the common vernacular today. So, are you clear? Sit at your tables. Facilitators, introduce yourself briefly. Everybody else, introduce yourselves. And come on down. And first question will be something along the lines of, what does wellness look like for a person in pain and or recovery? Second question is about, how can your profession assist this person? We're going to ask you to brainstorm a list of methods you could use. So raise your hand if you have questions. We'll come and help you. Thank you. Okay, so I'm curious, and I imagine other people are as well. It's always difficult to interrupt a conversation because this is really what we hope you will do. This is the best part. So you'll have another chance. So I'm curious, what did you learn? What kinds of ideas did you come up with? What pearls arose from your group? So Heather's going to run around with a microphone, and this is Heather. Say hi, Heather. So, thoughts, feedback, anything that came up in your group that you would like to share with the rest of us? Just put your hand up. Thank you, Ash.
So my group is quite lovely. One of the things that I learned today was the importance of individualizing people's healthcare, and that includes like understanding their goals and understanding their motivations rather than your own. So yeah, thank you.
Hi, I'm Jules. I learned in this group of students that we're going into a whole new generation of healthcare professionals that are more understanding than what's really out there now. They're all been really understanding to the lifestyle that I personally came from, and it's just a big relief knowing that generations below us are going to have like these great professionals.
Wow. Give yourselves a hand. Thanks, Jules.
I'm Abby. Just wanted to bring up the point in our group that any individuals coming to us, especially with chronic pain, we need to treat them like the experts they are in their own bodies. This table we talked about how he's the expert on his own body and he knows it very well. So,
thank you, Abby. That's great. Okay, actually, I'm just curious before we shift into the first part of Phase 2, the Phase 2A. Any thoughts about how your profession that you're training for could contribute to the health and wellness of persons with pain, substance use disorders, and/or recovery experiencing? Okay. One brave soul there in the back.
I think that an important thing for providers is to provide a non-judgmental, safe space for people to talk and then for us to shut up and listen. So I think that's important.
Thank you. Can you tell us your profession that you're training for?
PA.
Awesome. Thank you very much. That's great. And far be it from me to ignore my colleagues in Biddeford. Anything from you folks? Chris, did we hear from Biddeford at all? Don't be shy over there. Don't be shy. I know you're not shy. Thank you all. Thank you very much for your insights and what you've shared with us just now. We're going to move into Phase 2, and I would like to introduce okay, we don't have that there. I'd like to introduce Sam and Matt. Is that the slide you want there? No, it's not there.
That's fine.
Okay.
We can leave it there.
That's okay.
Yeah, Matt and I are pros at improving.
They both have short names. Sam is that person who's giggling right now, and Matt is the one who's not.
How typical of us.
We'll see if it stays that way.
It just might. I'm Sam Shepard. For those of you who don't know me, I am a non-traditional undergrad on the Biddeford campus. I'm finishing my pre-med degree. I was disabled with a pretty significant back injury for 4 years in my early 20s. The disability left me with 4 herniated discs in my lower back, a backward sacral torsion, occipital nerve headaches, a spinal strain, sciatic pain, you name it, I had it. I went through 4 years of rehab and regenerative therapies, and I'm here today able to carry a backpack running the Pain Education and Advocacy Collaborative, I am thankful for every moment of my recovery from chronic pain. Although I still experience it on a daily basis, I am able to put one foot in front of the other. And so that's a brief synopsis of myself, and here's Matt.
My name's Matthew Brown, and I'm a person in long-term recovery, and for me what that means is I'm way more than my disease. One, I'm a person. Two, I'm a brother to to a sister who didn't think that I even wanted her in my life. I'm a family member again, I'm a friend, I'm a mentor, I'm a lot of things. I have hopes, dreams, and aspirations, and by the way, I also had those hopes, dreams, and aspirations when I was using too, but I didn't really know how to tap into them. And there were some people along the way that helped empower me to tap into that, see my worth, see me as someone who was struggling, who just needed help. And at the young age of 19, I entered recovery, and I celebrated my 21st birthday, and I didn't go to a bar, and that's weird, right? But I found what I had been searching for through drugs and alcohol for 3 long, miserable years, from 16 to 19. I found my sense of purpose. And empowerment is something that both Sam and I talk about a lot, and people in both these communities, the pain community and the recovery community, find help them tremendously, tapping into what really drives them internally and being able to take charge of their own lives and fully buy into the definition of recovery that was shared earlier. But yeah, wellness is a great topic, and I'm an aspiring medical professional, as is Sam, and so we care about your personal growth and development. We care about your professional growth and development, and helping you better help people like us and people sitting at the tables, and better help yourselves to be the best people that you can be. And people. Over to you, I think, right?
I haven't received any questions from the Biddeford campus yet.
Okay.
So they're still pondering and will let us know if they have any.
Sounds good. So what questions do you have for Sam and or Matt? Folks out there. Any limits on these questions?
Never.
Okay.
The more uncomfortable, the better.
Remember your rules and terminology.
Our only limit is him. Just kidding. The Biddeford campus can't hear you if you shout, though.
Right. Let's let Rafferty go first, and you can use mine when she's done.
Hey, I'm curious to hear about how the pain community and recovery community intersect, intertwine, communicate, collaborate, all of that.
Excellent question. So traditionally, the pain and substance use disorder and recovery community have not collaborated together. So Matt and I actually met very briefly, actually 1 year ago, April 6th. And so I interviewed Matt last summer for like 6 hours, and listening to his story, he echoed everything that I experienced with chronic pain, just different. And so I was like, wow, I can't believe how similar his experience is to mine. And I had this epiphany. And, you know, we both have these similar experiences. We're both highly stigmatized groups of individuals. People with pain, you know, are often thought of as lazy, or, oh, you can't get over it. You know, maybe not by the people in this room, but by some of the general community. That was some of the stigmatization I felt. So, so there are a lot of different intersections that we have been exploring over the past year, and we've joined sort of forces in the Pain Education Advocacy Collaborative. We're trying to reformulate our name to include substance use disorder or recovery, just because there are so many similarities. And I know Matt definitely has more to share on this topic.
You all might think what I thought before meeting Sam and Ernie and some of the others in pain in the room, that people in recovery and people in pain are on opposite sides of the spectrum in terms of using opioids. That's what I thought. I thought people in recovery, and me personally, I was a strong advocate for no use of opioids at all, but yet meeting other, and I'm being intentionally intense on both sides. Of course, it's a continuum on both sides, but I thought that everyone in pain maybe was exactly the opposite, wanting maybe just to advocate, and that the people in recovery were maybe chasing after the pain patients to get their drugs. And I didn't think about the underlying causes. I had often thought about underlying causes, but I didn't realize that there were similar challenges, and that both groups felt so stigmatized, and that this idea of wellness and mental health were so intertwined that people in pain and people in recovery have to overcome incredibly challenging hurdles that are personal to their own stories, and that by going through that, they become so much stronger. And just on a personal level, just connecting with them just on a personal level really opened up my eyes to let's blur these lines. Let's see, of course there's going to be different treatments. Of course there's going to be sometimes different factors going involved. But if we can work collaboratively, we can have a twice as big voice. We can have a stronger impact. Some of the ideas that I have might help people in pain. Some of the ideas that people in pain have might help people in recovery, and just sharing these things together would make us a whole lot stronger. And we've, one last thing, and then I'll turn it back over. We've been talking to some people at the national level, and I'm really excited to tell you guys that UNE it seems to be one of the only groups across the country that is doing this collaboration, but especially between people with lived experience in pain and people in recovery. And there are some doctors groups working on some of this stuff, but mostly they focus on other stuff like methadone and other things. But this is really a unique opportunity, and certainly if you guys are interested in doing more work, we would love to work with you to help elevate some of this stuff, and we're doing our best to try to bring this attention to the national level.
Thanks, Matt. We have a question from Biddeford, and Andrew's in the queue as well. Should he go first? He's been waiting?
Yes.
Okay.
Andrew, and then we'll do BC.
Thank you. So this is a loaded question for both of you, but I'm going to quote something Matt said to me a number of years ago that really changed the way I did almost everything, and that was speaking to his sobriety and saying, I don't have to stay sober. In fact, I don't know if I will stay sober, but I can. And it was a very short kind of feeling that he shared, and it, again, kind of took this multiple ton weight off of my shoulders, like, there's all these things, and I got these chores that are, and it kind of transitioned my thought process to like, oh, but there are things that I can do, and let's focus more on the can instead of the have. And so I would kind of pose the question of what are some of the things that you guys did when you were in the midst of your most painful experiences, and what are some of the things that you do now that provide that shift in voice from I can't or I have to I can and it's possible?
Well, that's a hard question. So, when I was in my darkest days of experiencing chronic pain and in my disability, honestly, I've blocked out quite a few of them. They were so dark that I try never to go there again. In those deepest moments, experiencing such excruciating pain as what I felt, it took every ounce of energy in my body just to stay on this planet. So that's what I was thinking of then, is just what can I do to survive? I can't live like this. And about 3 years, 2 to 3 years into my disability, I met a new group of providers at a PT co-op, and my physical therapist took total charge of my case, reined everyone in, and got my providers to work together. My providers saw that I was sinking and that I couldn't see any light in the way up to the surface, and so they started this thought process in me, and so I've had this sort of transformative thought process, and I think that's what really has got me to where I am today. I still don't honestly know how I got out of those deep days, but it's my thought process. It's if I don't do it now, I will never do it. It's really hard to articulate, but it came from my providers empowering me, in all honesty.
And I'll just share one point. It's all about the word affirmation, that I learned a very important lesson in an English class that I didn't expect. And it was a class all about rhetoric, syntax, and style. And when you're talking about grammar, you don't expect to get a life lesson. But going back to how we edit things, that's how it started. And the professor said, I'm going to, don't be alarmed, there's a lot of red pen on your paper. And of course, the first thing we did was get really alarmed. But she said, really trust me, take a look. And as we were looking through it, she mentioned that she didn't just mark what we had done wrong, like historically the editing process would suggest. She also made sure to reinforce what we were doing right. Because how do we know what we're doing right unless it's reinforced by someone else? So that was a really powerful lesson in English for me, and it was a really powerful lesson in life, prevention, recovery, and that I focused so much on what was wrong with me and how horrible I was and all of my defects and the defects of others, that it was no wonder why I was so miserable all the time. And having that attitude shift of course life's going to be challenging. It's life. It's not always going to be easy. But I can't focus so much on my defects or any of those negative things quite as much, because it's quite literally going to rip me apart. And I can't do the same for others either, because there's so much value in people, and even if there's a lot of chaos going on, there's still positives. So focusing more on those positives than the negatives has really turned my life around.
Thank you. We're going to take our, thank you all for coming. You're doing a really good job of excusing yourselves. Wish you could stay. Last question from Biddeford.
Yes, let's answer this question from the Biddeford campus. So this question is to Matt. What helped you the most on your journey? And this is coming from one of our pre-OT students. What has helped you the most on your journey? If you had a pearl of wisdom or a trinket of something that has helped you the most, what would it be?
People telling me that my dreams are important and they're going to help me get there. And just that idea of empowerment has really been important, because I felt so low and I was that guy who walked around high school and didn't say any words at all, and looked at my feet and was really angry and everything, and no one knew what was going on except that they knew I wasn't participating, so they penalized me for all that stuff. But people started believing in me and telling me that my ideas mattered and that I mattered, and I started to believe that it was possible. But the navigating the barriers was challenging too, and we had a discussion up at the top level about being an advocate for your patient and for the other people in your life, and people started doing that, and I think that's really important. That helped me the most.
Thank you. Let's give them a great thank you. Thanks, Sam. Thanks, Matt. So we're moving into phase 2, and you now have on your tables a handout that describes the 8 dimensions of wellness. It's on the back. The other one is the one on the with the blue circles. Matt put together just to illustrate the severity of the numbers behind these experiences, the number of people who are experiencing these issues. So are we going to have them, we're going to have them talk about this in their groups, is that correct? Okay. So here's some new questions for phase 2. As you consider the discussion you had earlier and the pearls from Sam and Matt, what are your thoughts in terms of wellness for patients with chronic pain and or in recovery and or with substance use disorders? And what about your own individual wellness? What are you doing to care for yourself? We all know what the flight attendant says every time you hop on an airplane. What does he or she say? Put on your own oxygen mask first, and then help others next to you. So, what do you do? Talk about it at your table. What do you do to put on your own oxygen mask? And then what else do you want to know? That would help us feed forward the next session like this. So, got about 15, 20 minutes for that. What would you like to share about what you learned and what you talked about?
So Jason actually asked me how my use satisfied these 8 things? Which is a very, very deep and interesting question in a way that they can gain some understanding that they may be able to use moving forward and say, hey, I know you have a crew of people, a social component to drug use is you have some friends that you can count on, people you can call that will show up for you. Not always. There is a lot of undercutting. But you feel connected to a community that isn't judging you or making you feel like a loser, stigmatizing you, and in fact is like, hey, if you need me, I got you. Showing some compassion. And so, hey, I know you have this community. However, there's another community over here that's not going to judge you, that's not going to make you feel like a loser, that is actually going to encourage you to grow, encourage you to follow your passions, encourage you to your strengths. And in that way can immediately relate to where a person is at with maybe drug use or with pain in a different capacity than physical pain. But also encourage them to shift from the hardness, the darkness, to the potential solutions, to the recovery, towards the future, being drawn and led into the future instead of bullied by your past, which is an Ralph Waldo Emerson quote. But anyways, I thought that was super fascinating.
Wow.
Thank you, Jay.
That's a very cool question and very cool answer. I think Heather's behind you. Thank you, Andrew. What else? What else did you learn, came as an aha, or what struck you, surprised you, or confirmed something you already?
We were talking in our table, and I kind of like the connection that we made where 3 of us are PA students, and he was asking what we use to get through school and our immediate responses each other, and talking about the stresses that we go through, the individual contributions that we can make and all that stuff. And then we talked to him about what helped him get through his chronic pain, and it's his community and his contributions to his social network and the chronic pain group and all of that. And so it was just kind of a cool connection that getting through school, getting through something like chronic pain, the most important thing to us was our community, regardless of what you're going through.
Wow, great insight. It truly does take a village, at the risk of sounding like a cliche. It does, it really does. For all of us, I think we're social animals, and we're created to live in groups, and when we find our tribe, we find our peeps, whatever you want to call it, we are all better for it. Are we not? Am I right? Okay. Others. Insights, thoughts, takeaways. Anything from Biddeford? Oh, good, we got 2. Your choice there, Heather. Don't forget Ernie, though. Okay.
We're talking.
He still gets to talk. You can talk, Dale.
One of my elders. No, I just want to convey that, whether you know it or not, and our group talked about it, is even the students use the 8 dimensions to get their wellness and get through their education. And we realize that they're doing what we have to do also. Just wanted to point that out.
Thanks, Ernie.
I'm Devin. I'm from the PA program. I had a question for Jules about bridging the communities, because we are in healthcare, and there is a large stigma between the recovery community and the pain community and healthcare, and about being able to be present and finding that moment where you can help somebody. And she used the term closed door, open mind, open heart. And I thought that summated essentially what I was looking for in terms of how to be able to engage somebody who's in that moment.
Great mantra, great thought. Something to put on your door or your arm or somewhere so you keep it in your heart all the time.
Just a takeaway, we were talking about, and I know that numerous amount of people have talked about how people are people, and if you just treat them like people and not as a patient, then that can go a long way. because he brought up an example about how, you know, when you work in a pharmacy, it's a lot of like overturn, just prescribing and refilling medications. But if you take the time to just take a few minutes, ask them how their day is, see what they're doing here. If they seem frustrated or overwhelmed, try to help them calm down instead of just being like, okay, on to the next one, because it can make an overwhelming impact on how they go about their day and how they feel, you know, subjectified or not. So.
Great point. Only takes a couple of minutes, like you said. That's so important, and that's what will keep us from being replaced by machines. As machines can just dispense, but they can't be humans. So we're all in this together. Little editorial comment, because I can't help myself. My goal would be to make school something where you live in those 8 dimensions of wellness, and what you're not trying just to get through. That's just, couldn't help myself but share that. That's why I'm an educator, is education should be about learning, not about getting to the next thing. Dr. Brazeau?
You know, looking at these 8 dimensions, I guess I just summarize it in 3 simple things. An expectation for my own life and hopefully for others that I have. It's about working hard. You know, anything that in life is just working hard, and we're always going to work hard. But most important, secondly, it's about learning with passion. And part of your education here is to learn, but also learn how you learn. And so in the course of your, you know, your education, you're here, I hope you're going to learn, because we're educating you for only, you know, you're going to be here for 2 to 4 years, but you're going to have a 50-plus year career. So learning how you learn, and always have that passion, that intellect, and that could be how you learn spiritually. And finally, as I look at these, I think it's about enjoying life and enthusiasm. I think you've got to be able to take advantage and explore the places that you live and work, and find time with your spouses. I've been married to mine almost 38 years, and we always try to make a habit of getting out and doing things, and doing the things in your neighborhood. And to me, that's a simple thing. These 8 dimensions of wellness are all about those elements here. And if you can just, each day at the end of the day, you know, take a collective, what did you learn? How did you make someone's life better? How did you, and to me, that's about the passion. That's why we're all here. I truly believe we're here. It's about a passion about caring for individuals. But first of all, I think the lesson I've had to learn, and I hope you will learn it sooner than it took me to my mid-40s, it's okay to ask for help. That was a lesson I learned in my 40s, because I was one of these women that would say, I can do it, I can do it. And I realized that I love helping other people, but other people like to help you. And it's okay to ask for help. And hopefully maybe you'll learn that sooner than I did, because that also helps to build relationships when you're willing to be open and ask for help. Always be willing to give help, but always be willing to ask for help. So I'll leave it here with work hard, learn with passion, and enjoy life with enthusiasm. Because this is the real thing. This isn't the rehearsal.
Wow. Wow. I'd like to wrap it up there. However, because that would make a great closing statement. Thank you. We have 2 questions from Biddeford, and we are just about out of time. So can we answer those quickly?
We can attempt one of them. I know.
Okay.
I'll answer one. Matt will answer the other.
Okay. Really concise and crisp.
I'm just trying to find the verbiage of, and I found it. Okay. So, how did you change how you see yourself, and how did you change how you thought others and family members saw you as you slowly changed in your relationship to pain and substance use? I think my phone gave some feedback. So that's a really hard question. I am a total...
Can you answer it in 25 words or less?
I am a totally different person than I was 10 years ago before my disability. My disability was, in all honesty, it was the most difficult period of my life, but because of how it changed me, I am a better person today. I see people, I see beauty in everything. I never used to see beauty in everything, and now I see beauty in everything. It challenged me, like Dr. Bruzeau said, to ask others for help when I was always strong enough to do it myself beforehand. It's challenged me to grow and become a person that I'm proud of being today. It's, in many ways, it was the worst thing that ever happened to me, and it was the best thing that ever happened to me.
And this last question is just as difficult. For a lot of patients and clients, there's an inherent mistrust because the provider doesn't have the lived experience. How can we as providers bridge that gap? I absolutely love it. One way is just be real with us. That's what we want. And extrapolating to working with youth too, that's what youth want. They want to know that someone's going to be real with them. And so when we go in and share from the heart about what we went through, and sometimes talking about things being a solution, it resonates with them. So as a whatever profession you're in, I know, of course, they do it really, really well here at UNE, but ensuring that the provider and the patient are on the same level, and making sure that both feel that they are on the same level. Your colleagues, when you go into practice, who maybe come from other schools, we can't guarantee that you're going to get that type of experience from them. And so we would love for you to transmit that message. You're equals. The patient may have some incredibly great ideas about his or her own health and treatment and recovery and everything else. And as the educated professional you are, you can help guide that and work with them, that concept of mutuality, in really making sure that it's patient-centered and patient-focused, and if something doesn't necessarily feel appropriate, make sure it comes from a place of understanding and love, and saying, I don't really know if this is going to work. Maybe we should try something else, or even just honoring and letting test it out. And so really working with them, making sure they feel like their voice is valued and heard, that's going to go a long way.
Thank you. So, as we've talked about today, health is a state of complete body, mind, and spirit, and not just the absence of infirmity or illness. And as you walk out today, or Biddeford folks, comm students, you might want to put this in your reflective practice CBL group, of the things you learned today, contemplate this. What can you do for yourself to grow and continue to support your own wellness and thereby pass it on to others? Because remember, you can only take better care of others when you take care of yourself. So I want especially to thank today our guests, the people with lived experience who came in to share their experience, strength, and hope with us. Can we give them a big round of applause? Thank you all. And I hope that everyone has a wonderful, happy, healthy, vibrant day.